Now let us move forward towards the rotate fixed, that is the fourth generation CT. So there is a figure given in the book textbook, that is figure 19.7. I hope that you will all watch that photo once. Okay, so in that figure the configuration is easily visible. Detectors form a ring here. You can see it in the picture. If you open the textbook now along with this video, you will be able to watch. So the detection of the X-ray tube motion here, they have mentioned, and ring of stationary detectors they have mentioned, as well as the fan beam, and the patient is denoted over here. So the detectors form a ring that completely surrounds the patient, and the detectors are not moving, they are stationary. It has to be kept in mind that in fourth generation detectors do not move. This is a very important question for CRE. Okay, no need to again mention, please write it somewhere. X-ray tube rotates in a circle here. Okay, in this fourth generation X-ray tube are rotating only inside the detector ring, and the X-ray beam is collimated to form the fan beam. Means fan beam is there even in the fourth generation. Fan of detectors is always in the X-ray beam. A fan of detectors is always in the X-ray beam. You got it? Next is, some designs have used more than 2000 detectors. Means in fourth generation, means working beyond 2000 is not very unique thing. Means it's very common in fourth generation. That you can keep that in mind. When the X-ray tube is at pre-described angles, the exposed detectors are red. Means the X-ray tube, if the X-ray tube is at the pre-described levels, the pre-described angles, means which is already defined in that software, then the exposed detectors are red. If it is not, it will not be red. For example, in an angular sampling rate of one projection each 1/3 degree, means they have clearly defined in their software of the CT scanner machine that if the angular sampling rate of one projection 1/3 degree, then that will produce around 1080 projections in 360 rotation, and the projections are taken at many angles during the rotation of the X-ray tube. So the number of projections is going beyond 1000, and it is very common. Means it is the initiation, it can work more than that also. Okay, it has to be kept in mind that that's why the CT scan will be made up of many projection, and each of the projection taken at a slightly different angle. Means 1/3 degree difference only, there is a new projection. Got it? Got it? So these are very important questions. That is why I always repeat those lines again and again. And whatever important I am telling, you can make question out of it. You can write it somewhere. You can paste it on the wall, because you are having very less time. You can do whatever you want. You can just grasp the syllabus. You can just take whole of the syllabus in your mind, read it again 20, 30 times, 40 times. This is your call. The more the number of times you are reading, the more the chances of selection are. That you should keep in mind. So here both rotate and rotate fixed CT units, obviously they are giving excellent results. There is no clear advantage. So now also we are using the third generation, that we already know. The advantage of a fan beam or multiple detector array, what is the advantage of it is speed. Obviously the multiple detectors will gather more data, faster data than a single detector. And one principal disadvantage of the fan beam is increased amount of scattered radiation. At the high energy used for CT, it will usually be 120 kVp around. Compton scattering is a common basic interaction here at high energies. So you can just keep this in mind. In CT, at high energies used for CT, usually 120 kVp. What is the which kind of scattering is more common? So Compton. This is again a very good question. The total number of Compton reactions is nearly the same for pencil beam and fan beam scanners, but the scattered photons are more likely to be recorded by a fan beam unit. See, what they are saying is total number of Compton reaction is nearly the same for even if you are using pencil beam or you are using, would say, fan beam, but the scattered photons are more likely to be recorded by a fan beam, obviously, because they are in fan in nature, so they can scatter. Got it? They are scattering more as compared to the fan beam. That is why. So these are the few questions, a little bit conceptual, that can be easily solved. So you should focus more on these questions, so to get the most out of it. Got it? In the fan beam scanner, the same two scattered photons generated from the early. See, there is one more photo, 19.8, figure 19.8. You can watch it in the what's say book. So in that, what they are seeing here is pencil beam they are showing, and they are also showing the fan beam, which is having more scattered photons that they are showing. So they can give you some picture, and a picture based questions also they can use. So from the same volume of tissue, they are having different kind of noise. The problem of the scattered radiation is exaggerated. See, first, the likelihood of nothing is important here. One thing is important: the detector in a fan beam array have their own individual collimators. See, whenever you are using fan beam geometry, the detectors will have their individual collimators. That should be kept in mind. Okay, very good question. Most scattered photons are absorbed by these collimators. Okay, that much is there in fourth generation. Other scan configurations are there that I'll discuss in the next session. Thank you.